South Africa's efforts to fight the spread of COVID-19 continues to attract help from international bodies. The United Nations Development Programme handed over personal protective equipment worth millions of rand to the Gauteng Health Department. The consignment includes surgical masks, face shields and disposable overalls. Let's discuss this further. We're joined by the UNDP's representative for South Africa, Dr. Ayodele Odusola. Good evening and thank you so much for your time on News at Prime. Firstly, your own perhaps analysis of South Africa's response to COVID-19 so far. How do you think that we are doing?
Thank you very much, and thank you for inviting me. Let me just start by really acknowledging the strong leadership role of the government of South Africa in addressing the issue of COVID-19. If you look at the way we started on the 5th of March, and the kind of very bold and firm decisions taken by the government in terms of making sure that we are not overwhelmed by the rise and the spread of COVID-19. It is really one of the things which I consider to be one of the bold actions in Africa. And it really set the pace for many other African countries to follow in terms of what the South African government is doing. One, it's been able to really test the largest number you can ever think on the continent. And screening over 20 million and testing over 2 million people is not as simple as that. And I think this is a kind of leadership role they have played. And the fact that they do not really even open up for the economic activities to really come up immediately after the lockdown shows that they are really, really taking a lot of cautious action to be sure that everything is under control. Unfortunately, it's rising now, but I think with the support of everybody, the private sector, the civil society organizations, and the people themselves will be able to get at it and flatten the curve very soon.
You talk about bold action that the government has taken so far. Perhaps point me to 3 decisions which you as the UN Development Programme have looked at and thought, geez, this is something that has been extraordinary and in fact warranted for in the situation.
Well, thank you very much. It's a bold action in the sense that we see that the government is showing the right leadership because addressing pandemic like COVID-19 calls for 2 quick things. One, leadership and solidarity. And the role of the United Nations system in South Africa as well as the United Nations Development Programme is to solidarize with government, work with government, because the pandemic cannot be addressed by the government alone. Neither can it be addressed by government and the private sector alone. The people, the government, the private sector, the international organizations, which UNDP is trying to play in this respect, is one of the efforts we consider to be very important to support the government to achieve the goal they have set in terms of controlling COVID-19 and making sure the well-being of people of South Africa is really taken into consideration. And that's what really informed the support we've been giving to the municipalities, to provinces, even to national government. One, we started with the city of Johannesburg, where we gave them PPE, which we consider to be very important for frontline workers, as well as communities that cannot afford them. It's the same thing we did to the province of Gauteng, which early in the week, just last week. And we thought this is one of the things we need to do to really support government to really be able to control and put COVID-19 under control so that people can go back to their normal life as soon as possible.
The unemployment rate in South Africa has skyrocketed and I suppose perpetuated by the lockdown that has been implemented as a result of COVID-19. When you look at the full impact of what this will be, what do you think are going to be some of the biggest problems that emerge from our society, from some of these issues that are being exacerbated by this virus?
Well, one thing that is very clear across the world is that for you to really control COVID-19, you have to worsen economic activities. That's really one of the major side effects because it's really affecting economic activity of the people, the livelihood, the incomes, jobs, have been seriously affected across all countries, and particularly in South Africa. And I want to underscore the effect on the informal sector operators, those that are living in informal settlements. These are the people that are hardest hit. And the main challenge, which we have found on the basis of socioeconomic impact assessment, which we just undertaken, is that it will take a minimum of 5 years for us to go back to the COVID era in terms of the trend of economic activities, unless something very, very innovative is done. That's what will take us back to the growth trajectory as early as possible. And the level of poverty has really worsened. We realize that about 54% of those that are pushed out of formal job into informal sector are likely to fall into poverty. And the same thing with having about 34% of people that are currently considered to be middle class to fall into poverty. This translates to about 3.2 million people of those that are categorized as middle class people. Now, the most intriguing part, and what I consider to be the most serious part, is the impact on inequality, because the people that are heavily affected are those that are in the informal sector, those that are semi-skilled or unskilled workers, whereas those that are highly skilled are not seriously affected, meaning it will definitely widen the level of inequality in the society. And I think this is one of the areas which the Solidarity Fund, the government, as well as private sector, need to really focus attention on to ensure that COVID-19 does not worsen the level of inequality in the society.
We've seen the implementation of the 350 Rand relief fund for some South Africans. We've also had an increase to some of the income grants. But there's been a lot of talk about having a universal basic income grant, especially for people between the ages of 18, I believe, and just right up to the early 50s. Do you think that that would be a necessary intervention for South Africa right now, given the kind of figures that you've just read out to us?
Well, this is an abnormal situation, and an abnormal situation requires some kind of new initiative. It may be difficult for us, for government, to really give what is considered to be the level of income or the level of grant that will take people out of poverty. The idea is just to make sure it cushions the impact of COVID-19 on the people. It is not really to replace or to substitute the level of income that is needed under a normal environment. And we consider this to be one of the highest in Africa, because having put in about 10% of your gross domestic product on a stimulus package is hard. And I consider this to be one of the other areas that the international communities need to work with the government and people of South Africa to make sure additional resources are made available so that the gaps are filled. And those that are not really benefiting at this particular moment are really brought into the fold of those that will benefit in the stimulus package. And I think it's a good initiative in the right direction. But once the opportunity comes for additional resources to be added, we need to really add this so that people that are not benefiting from it at this particular moment will have the privilege of being part of the process.
All right. The UNDP's representative for South Africa, Dr. Ayodele Odusola.